We have record of ADD in the medical literature dating back to as early as 1904. We have to believe that ADD, which we now call ADHD, existed before 1904 and probably long before 1904. Why? Well, because it has a strong genetic component. If you have a close relative that has ADHD, there's a much higher probability that you will have ADHD. And that probability goes up depending on how closely related to that person you happen to be. Now, if you have a close relative with ADHD, that does not mean that you are fated to have ADHD. And if you happen to have ADHD, there are ways to overcome those symptoms of lack of attention, impulsivity, and so on. Another important point about ADHD is that it has nothing to do with intelligence. Whether or not we're talking about intelligence measured by a standard IQ test, a rather controversial issue, as many of you probably know. There are lots of forms of intelligence that a standard IQ test just wouldn't pick up. Emotional intelligence, musical intelligence, spatial intelligence, all sorts of intelligences. None of them are related to ADHD. Being very high functioning doesn't make you more likely to have ADHD, and being ADHD doesn't necessarily mean that you have a low IQ. The other thing that we are seeing a lot nowadays is increased levels of ADHD in adults. And there's some question as to whether or not those adults had ADHD that went undetected during their childhood, or whether or not ADHD is now cropping up in adulthood due to the way that we are interacting with the world. In particular, smartphone use, the combination of email, text, real-world interactions, multiple apps and streams of media and social media all coming in at once, trying to manage life. All of the things that are going on are creating a kind of cloud of pulls on our attention. And so there is this question to whether or not we are creating ADHD in adults that never had ADHD prior to being an adult. So let's talk about attention. If I say attention or focus, I'm basically referring to the same thing, unless I specify otherwise. So people with ADHD have trouble holding their attention. What is attention? Well, attention is perception. It's how we are perceiving the sensory world. So just a little bit of neurobiology 101, we are sensing things all the time. There's information coming into our nervous system all the time. For instance, right now, you're hearing sound waves. You are seeing things. You are sensing things against your skin, but you are only paying attention to some of those. And the ones that you're paying attention to are your perceptions. If you hear my voice, you are perceiving my voice. You are not paying attention to your other senses at the moment. People with ADHD have poor attention and they have high levels of impulsivity. They are easily distractible. But the way that shows up is very surprising. You might think that people with ADHD just simply can't attend to anything. They really can't focus, even if they really want to. But that's simply not the case. People with ADHD, yes, they are distractible. Yes, they are impulsive. Yes, they are easily annoyed by things happening in the room. They sometimes have a high level of emotionality as well. Not always, but often. However, people with ADHD can have a hyper-focus, an incredible ability to focus on things that they really enjoy or are intrigued by. There are a couple other things that people with ADHD display quite often. One is challenges with time perception. People with ADHD often run late. They often procrastinate. But what's interesting and surprising is that if they are given a deadline, they actually can perceive time very well. And they often can focus very well if the consequences of not completing a task or not attending are severe enough. In addition, their spatial organization skills are often subpar. Not always, but often you will find that somebody with ADHD uses what's called the pile system in order to organize things. They will take many belongings, and this could be in the kitchen or in their bedroom or in their office, or in any space, and they will start piling things up according to a categorization system that makes sense to them and only them. Many people use the pile system, and if you use the pile system, that doesn't mean that you have ADHD. In fact, if you're unpacking a house, or you've moved recently, or you've received a lot of presents recently, the pile system makes perfect sense to organize your space. But people with ADHD tend to organize things according to the pile system all the time, and that pile system doesn't work for them. The other thing that people with ADHD have real trouble with is so-called working memory. Now, you might think that people with ADHD would have really poor memories, but in fact, that's not the case. People with ADHD often can have a terrific memory for past events. They can remember upcoming events quite well. Their memory is clearly working. However, one aspect of memory in particular that we call working memory is often disrupted. Working memory is the ability to keep specific information online, to recycle it in your brain over and over again so that you can use it in the immediate or short term. So we've more or less established the kind of menu of items that people with ADHD tend to have. Some have all of them, some have just a subset of them. So now you have the contour of what ADHD is. And if you're somebody who doesn't have ADHD, you should also be asking yourself which aspects of ADHD are similar to things I've experienced before. So let's drill into this issue of why people with ADHD actually can focus very intensely on things that they enjoy and are curious about. Enjoyment and curiosity are psychological terms, but from a neurobiological perspective, they have a very clear identity and signature, and that's dopamine. Dopamine is released from neurons. It's what we call a neuromodulator, and as a neuromodulator, it changes the activity of the circuits in the brain such that certain circuits are more active than others. And in particular, dopamine creates a heightened state of focus. But dopamine as a neuromodulator is also involved in changing the way that we perceive the world. Dopamine, when it's released in our brain, tends to turn on areas of our brain that narrow our visual focus and our auditory focus. So it creates a cone of auditory attention that's very narrow, creates a tunnel of visual attention that's very narrow. Whereas when we have less dopamine, we tend to view the entire world. We tend to see the whole scene that we are in. We tend to hear everything all at once. So there are two main types of circuits that we need to think about with respect to ADHD, attention and dopamine. The first one is called the default mode network. The default mode network is the network of brain areas in your brain, in my brain, and in everybody's brain that is active when we're not doing anything, when we're just sitting there idle at rest. The other set of circuits are the task networks, the networks of the brain that make you goal-oriented, or that are at least trying to make you goal-oriented. And those are a completely different set of brain areas. However, the default mode network and these task networks are communicating with one another, and they're doing that in very interesting ways. That's how it is in a typical person. In a person with ADHD, or even a person who has subclinical ADHD, or in any human being who hasn't slept well, what you find is the default mode network is not synchronized. These brain areas are just not playing well together. Now, normally, in a person without ADHD, the task networks and the default mode networks are going in kind of seesaw fashion. They are actually what we call anticorrelated. So it's not just that they are not correlated, they are actually opposing one another. They are anticorrelated. In a person with ADHD, the default mode networks and the task networks are actually more coordinated. What dopamine is doing in this context is dopamine is acting like a conductor. Dopamine is saying this circuit should be active, then that circuit should be active. It should be default mode network, and then when the default mode network is not active, then it should be the task network. So it's really acting as a conductor saying, you go, now you go, now you go, now you go. And in ADHD, there's something about the dopamine system that is not allowing it to conduct these networks. So dopamine and low levels of dopamine apparently are what's wrong in people with ADHD.